Here are 10 USMLE-style multiple-choice questions, MCQs, focused on Salmonella typhi, each with 5 answer choices, the correct answer, and explanations for why the other choices are incorrect, all in English. Question 1, clinical presentation. A 25-year-old man returns from a trip to India and presents with persistent fever, abdominal pain, constipation, followed by diarrhea, and a rose-colored macular rash on the trunk. What is the most likely diagnosis? A. Typhoid fever. B. Paratyphoid fever. C. Shigellosis. D. Traveler's diarrhea. E. Campylobacter enteritis. Correct answer, typhoid fever. Why not the others? B. S. paratyphi can cause similar illness but is usually milder. C. Shigella causes bloody diarrhea and tenesmus, not rose spots or pulse temperature dissociation. D. E-tech causes watery diarrhea without systemic symptoms like fever and rash. E. Campylobacter causes bloody diarrhea and abdominal cramps, but not the systemic signs described. Question 2. Transmission. What is the primary mode of transmission for Salmonella typhi? A. Airborne droplets. B. Sexual contact. C. Fecal oral. D. Insect bite. E. Blood transfusion. Correct answer, C. Fecal oral. Why not the others? A. Not transmitted via respiratory droplets. B. Not sexually transmitted. D. Insect vectors are not involved. E. Rare, not a primary transmission route. Question 3. Microbiology. Which of the following best describes Salmonella typhi? A. Gram-positive, strict anaerobe. B. Gram-negative, facultative aerobe. C. Gram-negative, strict anaerobe. D. Gram-positive, facultative aerobe. E. Gram-positive, facultative anaerobe. Correct answer, B. Gram-negative, facultative aerobe. Why not the others? A, D, E. It is gram-negative, not positive. C. It's facultative, not strict anaerobe. Question 4. Treatment. What is the treatment of choice for uncomplicated typhoid fever in areas without significant drug resistance? A. Amoxicillin. B. Azithromycin. C. Ciprofloxacin. D. Ceftriaxone. E. Doxycycline. Correct answer C. Ciprofloxacin. Why not the others? A. Resistance is common. B. Effective but often second line. D. Used in severe cases or resistance. E. Not first line for typhoid fever. Question 5. Diagnosis. What is the most reliable method for confirming a diagnosis of typhoid fever? A. Whittle test. B. Blood culture. C. Stool culture. D. IgM serology. E. Abdominal ultrasound. Correct answer B. Blood culture. Why not the others? A. Whittle test lacks specificity sensitivity. C. Less sensitive in early disease. D. IgM serology is not specific. E. Imaging doesn't confirm the diagnosis. Question 6. Complication. What is the most feared gastrointestinal complication of untreated typhoid fever? A. Renal failure. B. Intestinal perforation. C. Meningitis. D. Myocarditis. E. Pneumonia. Correct answer B. Intestinal perforation. Why not the others? A, C, D. These are rare or unrelated complications. Question 7. Prevention. What is the most effective way to prevent typhoid fever in travelers to endemic areas? A. Insect repellent. B. Typhoid vaccination. C. Antibiotic prophylaxis. D. Face masks. E. Avoiding animal contact. Correct answer B. Typhoid vaccination. Why not the others? A, D, E. Irrelevant to fecal oral transmission. C. Antibiotic prophylaxis is not recommended. Question 8. Chronic carriage. In chronic carriers, Salmonella typhi most commonly colonizes which organ? A. Liver. B. Spleen. C. Gallbladder. D. Small intestine. E. Bone marrow. Correct answer C. Gallbladder. Why not the others? A, B, D, E. S. typhi can reach these but does not persist long-term there. Question 9. Culture media. Which of the following is most suitable for culturing Salmonella typhi from stool? A. McConkey agar. B. Blood agar. C. XLD agar. Chocolate agar. E. Sabarot agar. C. XLD agar. Why not the others? A. Can grow it but not selective. B. Not differential for enteric pathogens. D. For fastidious respiratory bacteria. E. For fungi, not bacteria. Question 10. Antibiotic resistance. A strain of S. typhi isolated from a returning traveler shows resistance to ciprofloxacin and ampicillin. What is the most appropriate alternative treatment? A. Amoxicillin. B. Ciprofloxacin C. Azithromycin. D. Chloramphenicol. E. Tetracycline. Correct answer, azithromycin. Why not the others? A, B, resistance present. D, effective but with severe side effects and limited use. E, not reliable for resistant S. typhi strains. Would you like a printable or PDF version of these